Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for adults with a sore throat. Tip number 1 is know when to see a doctor. A sore throat is an extremely common condition in adults, and most of the time you will not need to see a doctor. A sore throat can be treated with over-the-counter medications or with nothing at all, and it will go away on its own. However, there are certain circumstances where it is important for you to go see a doctor, and even other circumstances where you should call 911. So, if your sore throat is accompanied by a fever, and a fever is a temperature of 101 degrees Fahrenheit or 38.4 degrees Celsius or higher, then you should see your doctor. Also, if you're immunocompromised for any reason, for example, if you have HIV, are taking oral steroids, have cancer, or even if you have diabetes, then you're at risk of complications from your sore throat, and you should also see a doctor. There are certain circumstances where you should call 911. These are if you have a sore throat and you're unable to swallow, meaning that your throat becomes blocked off, you're drooling, you have difficulty breathing, or your neck is swelling. Most of the cases are not severe, so this only applies to a very small percentage of people. Tip number 2, if you see a doctor, then you may be prescribed antibiotic treatment for your sore throat. So antibiotic treatment is recommended to treat strep throat. And the reason for this is that people with strep throat can go on to develop acute rheumatic fever, and later on in their lives, this can cause damage to the heart. So there are other benefits also to antibiotics when you have strep throat. Strep throat, though, is only a minority of cases of sore throat. And your doctor can tell the difference between sore throat that's strep throat and sore throat that's due to something else. So if you have, your doctor will most likely use the Centaur criteria to determine if you should be tested further for strep throat. The testing for strep throat, or the clinical symptoms that would suggest that you should be tested for strep throat, are a fever, not having a cough, having tonsillar exudates, which are white patches on your tonsils, and your tonsils are at the back of your neck, and swelling and tenderness of your anterior cervical lymph nodes. Most of the time, if you have 2 or more of these symptoms, your doctor will either swab the back of your throat for a rapid test or swab the back of your throat for a throat culture. And the results of this culture will determine whether or not you have strep throat and whether or not you need, and if you do have strep throat, that would mean you would need antibiotics. If you have less than these 2 criteria, in most cases, your doctor won't even send swab your throat for culture or rapid strep, because if you have less than 2 of those symptoms, then it's likely that you don't have strep throat. If you do have strep throat and your doctor does prescribe antibiotics, most of the time this will be oral penicillin, 500 milligrams, 2 to 3 times a day for 10 days. Or if you have a severe penicillin allergy, it will be azithromycin, starting with 500 milligrams on the first day, and then 250 milligrams for 4 more days after that. If you are prescribed antibiotics for strep throat, it's important that you stay out of work or out of school for the first 24 hours of treatment to prevent transmitting it to others. And whenever you're prescribed antibiotics, it's very important for you to complete your entire course of antibiotics, because even though you're going to feel better after the first 3 days of using antibiotics, if you don't finish the whole bottle, then there's still going to be bacteria around that haven't died yet, and they will become resistant to the antibiotic, which can become a very serious situation, because the next time you're treated, the antibiotics will not work. So tip number 1 was the symptoms when you should see a doctor. Tip number 2 is how your doctor will decide whether or not to give you antibiotics and how you should take these antibiotics. The remaining tips are, if you don't have symptoms that need to be evaluated by a doctor, what you can do on your own. So this is tip number 3. Tip number 3 is how to prevent how to prevent sore throat. And the number 1 tip I have is to avoid people who are sick. Avoiding people who are sick is the most effective way of not becoming sick yourself. Tip number 4 is frequent hand washing. Frequent hand washing is a good thing to do all the time to prevent all sorts of infection, and it's helpful to prevent transmission of sore throat. Tip number 5 is prevent your hand touching your mouth or your face. So the most common way for a sore throat to be spread, and the most common cause of a sore throat is a virus, is for you to be around someone who has a viral infection, a sore throat, for them to touch something or to touch you, and then for you to bring your hand to your face, either your mouth or your nose. So that's the most common way of transmitting a sore throat. The way for you to break this cycle is for you to either make sure you wash your hands if you're ever in contact with someone with sore throat, or just when you are around them and you do touch your hands to something, make sure you avoid touching your face until you have a chance to wash your hands. Tip number 6 is how to prevent you giving sore throat to others. So if you sneeze, it's important for you not to sneeze into your hands, because if you sneeze into your hands and then you touch someone, or you sneeze into your hands and you work on a computer, or you turn a doorknob, anyone who comes after you who touches those surfaces can get your germs. So if you do have to sneeze into a tissue or sneeze into your shoulder to prevent transmitting the virus from your hands to them. Tip number 7. So those tips tip number 1 was when to see a doctor. Tip number 2 is what your doctor will consider when giving you antibiotics and how you should take them. Tip number 3 through 6 were tips for preventing the spread of sore throat. Tip number 7 now is and 8 and 9 will be treatments for the sore throat. So tip number 7, we're going to start with the least expensive and the least side effects treatments, and then we'll move up from there. So the most simple, cheapest way of treating sore throat is just gargling salt water. Usually half a teaspoon of salt water in a cup of warm water, and you just gargle it. There are no studies to show that this works, but a lot of people do think it has a benefit. It's worth trying before you go out and buy something. If you find that gargling salt water doesn't relieve your symptoms and you need something more, then there are many over-the-counter options that are just work locally. So they are lozenges and sprays. And sprays there are all types of brands: Hall's, Sucrets, Cepacol, Chloraseptic. You can try any of these. Usually the lozenges are around longer than the sprays, so they might be more effective for you. There's also a brand name Throat Coat, which is a tea that has been shown in studies to be effective for making your sore throat feel better. All of these lozenges, sprays, and this tea work by numbing your throat right at the point where you're having tenderness. So tip number 7 are these local treatments right at where you're having the pain. Tip number 8 is systemic treatment, or a treatment that goes throughout your body, and that's Tylenol. So Tylenol will be more effective than all of these local treatments. However, Tylenol is a systemic, it works through your whole body. So if you can avoid taking a drug that affects your whole body, it's probably better to just stick with the local treatments. But if these local treatments are not helping you, Tylenol is the next step. And Tylenol should be taken, or Tylenol is the name brand, but acetaminophen is the generic name. You should take up to 1 gram every 6 hours for relief of your pain. Tip number 9 is ibuprofen. The brand name is Motrin or Advil. Motrin or Advil or ibuprofen is more effective at pain relief than Tylenol, and its maximum dose is 600 milligrams every 6 hours. This is a medication you should always take with food, as it can cause stomach upset if you don't. So, going over all of these tips. Tip number 1 is when to see a doctor. Tip number 2 was what your doctor will consider when deciding whether or not to treat whether or not you have strep throat and how you should take antibiotics. Tip number 3 through 6 are preventive tips. Tip number 7, 8, and 9 are treatments for throat pain. And tip number 10 is to believe in yourself. Sore throat is extremely common, and in the majority of cases it can be treated without being evaluated by a doctor and with therapies that are effective in reducing your pain. I hope these tips have been helpful. Thank you very much for listening, and have a great day.